Lori. Oh, good. Did you all get the recording in progress? Note. Okay. Yeah, please feel free to put your name in the chat, who you're with, or even why you're here. Love to hear. Make this a bit of a two-way conversation in the 1 hour that we have. We have a lot packed in the hour. And a lot of folks joining us. I'm just thrilled to see various sectors, several business leaders, several organizations, charitable organizations, and our fund holders. There's many fund holders, individuals and families, as well as agencies that we hold funds for. Oh, this is great. There may be up to 50 joining us. So we've got 34 so far. So it might be only another minute or so. Hi, Cheryl from Reed. I think Jen brought out her whole family. Thank you for doing that, Jen. Oh, let's not go too crazy on the slides here. Did that just move? There we go. Kathy, who's on our Vital Sign Advisory Committee. Thanks for coming out again today. Kristen, nice to see you. Karen Bradley with Affinity now. That's great. Jenny, United Way, right? I'm trying to remember. When you don't see and run into people, then you tend to forget. But really nice to see the many faces here today and names. Hi, Monica. Good to see you. On our advisory committee, Roy, the chambers here. It's unfortunate more of you couldn't come, but thank you, Margot, for attending. You guys are going through busy times. Yeah, please put your name in the chat and who you're with. Love to know, love to share that with all of us. Well, I'm going to be just doing a few minutes of intro, but I will be turning this over after we get started in a moment or two to our community data expert. I know you don't like me calling you that, Colleen, but that's who you are. And to Don, our grants manager, I'll be turning it over to him, who's really passionate about all things community and really steadfastly, took this project through a few starts and stops. Nice to have you, Amber Lee, past board member and also a fund holder. Thank you. This is great. Really, I mean, it really gives us energy when we see the kind of interest that's being expressed. This won't be the last time we do a presentation. We are open to doing that to anyone who's interested. And we're also open to having more in-depth conversations on any of the information that we're going to share or that's in the report itself. Hi, Eric from Sherbrooke. Allison also on the committee. Good to see you here. This is great. Thank you. Is there anyone from Sarita here? I know a couple of folks were going to come, or at least one for sure. Jen brought me coffee, so thank you, Jen. That was really nice. When I said, oh, I need a coffee and I need to show my the logo. And so here we go. I got both. Well, when we get to 40, do you want me to start? We're at 39. Hi, Jenny. I can see you now. Can't see everyone. Few folks from the city of Saskatoon. That is fantastic. Well, we're a few minutes past, right? Why don't we get started? How about a few thumbs up? We're going to get started. We have a full hour planned, so let's do this. Thank you all for sharing of your time. It's challenging times, and we've heard it often in the past 2 years that, you know, we're constantly having to navigate whether it's home life, work life. So sharing of your time today is much appreciated. It gives us strength to do the things that we're doing, and hopefully it's reciprocated. It's a huge honor for me to be sharing this report. It's with much anticipation that we're sharing this with the community. It's been a lot of start and stops, as probably many of the things you've been involved in the last couple of years. But here we are, and very happy to see the kind of turnout today. Things are busy right now, which is a good thing. A lot of folks from our community, our CBO sector, a lot of the agencies are here that we hold funds, our fund holders as well, and board members are attending, and business members and leaders in the community. Thank you so much for taking the time today. We wanted to roll this out during spring intentionally. Really, spring is a time of that rebirth and that renewal. And so, I mean, it's not only true in nature, but also in the cycle of our lives. And so we thought this would be a good time to bring this information. It's stark, you know, in terms of what the data tells us. But I think we draw that strength by each of us doing what we can to make it a stronger and more vibrant community. Thankful that I'm on Treaty 6 territory, the land of many nations and the traditional homeland of the Métis. It's cleanup campaign time. Meewasin Valley Authority is doing their cleanup campaign, and I've been associated with that campaign from the beginning in a different hat that I wore years ago. And my Nutana Rotary Club did a couple of sessions. So encourage you all to also pay your respects to the land that we have and the beautiful land of Saskatchewan and Saskatoon. So the session is being recorded. You're all aware of that. Here we go. So vital signs. Did I miss anything? Someone, I think we're good. I paid thanks to those that are joining me, but also to Colleen Christopherson Cote and Don Yules, our vital signs consultants and our grant manager who really stewarded this and shepherded it through a lot of starts and stops. And to our advisory committee, which I'll show you who they all are in a moment. We could not have done this without all of you. So here we go. This is really a data snapshot. It's been a challenge because we normally would like to bring in good Stats Canada data to show us some trends. That wasn't available, recent data. So we had to rely on the charitable sector, many data partners to bring together that information this year. I think we started this in late 2019. So we're happy to be here to roll this out. We're joining many community foundations across Canada and indeed throughout the world that have a vital signs program. This report is part of that. There's other aspects, there's conversations, there are deeper dives into various areas. It's us joining in partnership to a lot of the tables that are existing in the community that we can also provide our support, but really amplifying information that you likely already know and likely have already seen, but we feel it's important to add our voice to that. That we've evolved vital signs over the last 2 iterations, and we really, you know, no matter what data we present and what measures we present, the greatness of our community, I love this quote, is really only measured by the compassionate actions of members in it. And so making the data actionable and something that we feel that we can have a hand in and not be overwhelmed by sort of what's going on in our community, because there is no doubt that our community and many groups in the community are suffering. But it's our action collectively that's going to make that difference. So we're going to talk a bit about what vital signs is about, and I've mentioned most of that, but also why do we want to care about it? The story we want to tell is, and Colleen will really explain this, I know very well, is through values. And this framework we've created through the help of those on the data team, Michael Hemlick and Brian Hosler with Colleen, really presented a common framework and schema to to perhaps bring shared community data into the future. We're going to deal with, there's a lot there. So we've decided to bring together 7 key learnings, and we identified it as 7 because I felt a real strong relationship to the 7 sacred teachings in Indigenous worldviews. And these are our learnings. You can see the data, you can see that they may mean something different to you and where you are in your organization, in your life. But we thought we would present it in a way that provides at least a bit of a rally around some of the key things. Pay attention to those, because when it's your turn, you're going to be in some breakouts, and we're gonna get your input into which of those learnings resonate with you. And also, you can't have a data report without having a survey at the end. And so Joanna's got a survey for us that she will put in the chat later, and we'll also email to all of you. It's this team that really made this work happen and drove, and they persevered through the starts and stops, all cross section of our community, business, interested individuals, various organizations. We thank you for your time and working through with us, and to our team here at the Community Foundation. It does take a village, and this is the village that we were able to work with over the last 2 years to guide us through this. They presented the information in a way that made it actionable. And I also want to really give recognition to our agency that we worked with, Chess Club, previously called MGM. And they worked through really trying to provide these infographics that were relevant and did not always show a deficit in what it was trying to portray. And that was a challenge. So we appreciate their work in bringing together the information in this infographic format in the report, so that it can be digestible and easily accessible for many individuals. And we know from past experiences, all various kinds of sectors that access this information. We appreciate that, because that does tell us that it's a value and it's needed. So it provides a bit of a path. As I've mentioned, life it's complex and it's overwhelming in terms of what can we do. And sometimes we get paralyzed with not knowing where to start. So this perhaps provides a bit of that path for addressing needs in the community and really opportunities to make that difference. To have conversations, whether it's in your own kitchen, whether it's in a boardroom, whether it's, at home on the couch, wherever it may be, talk about what's happening in the community. Think about things that you can do to show up and to make a difference. Again, at the end, it's really about making change happen. I love a saying that I've often said in the past, and that is, if you always do what you've always done, you always will get what you've always got. So unless we do things differently, it will be the same. And I think we're all waiting to move that forward. And thank you for being here today. So it's about finding out what our community cares about. That's what the pathway is in Vital Signs. And so there is no greater power than us discovering that. And we took great care in really identifying and selecting this image in the Vital Signs report. It has a lot of significance as we come out of the pandemic. And this is a big part of Vital Signs. It really is as we come out of the pandemic from the various sectors. This image is the smudge walk that took place on the first National Day of Truth and Reconciliation in honor of residential school survivors, as well as missing and murdered Indigenous women and girls. So it's those calls to action and calls to justice that the community came together. I mean, doesn't this speak to humanity in our community? All ages, all walks of life were part of this historical moment. And it was the findings of the mass graves. And Elder taught me that it wasn't a discovery. They knew that all along. It was a truth they were sharing, and it had awakened all of Canada to know that it was the findings of the mass graves, the 215 and the 751, and then the others that have been also since that time, that really allowed us to really see and accept the truth. Their evidence was there, and it really has now changed us forever. And that's why we wanted to put that on the front cover. as I mentioned, a lot of data, community data does exist in the community, and Colleen and the team there, and she'll go into more detail here, but this is the powerful tool. This is the framework that brings together, it tells the story, it tells what matters to all of us. And the advisory committee really looked at all those value points and digested it, and the wording was critically important to say it as it is. And it's through that sort of collective framework that we can now perhaps, we'll continue this in future reports so that we can observe our changes. It does illuminate the story of Saskatoon, making it really accessible to all. And here is that story. I mean, embedded in the values framework, first time for us was to take a look at the Sustainable Development Goals, the United Nations goals. That's really the international standard of measuring various aspects and quality of life in a community. In the report, it shows that. It also shows the Truth and Reconciliation Commission calls to action. In the report, it also shows how that's embedded. But in the center there is the values framework. That is the powerful tool. We felt that in the middle is really about, as we come out of the pandemic, is about wellness. It's about all the systems that work together for that quality of life. And that is at the center. There's many aspects that really influence our wellness. It is income, it is housing, it's food security, it's physical and mental health supports. It's really all of that that becomes critically important. And you can see that all of the other values contribute to the wellness, and equity being a key one. There's some dotted lines, there's some solid lines, and equity, it really emphasizes the importance of it in terms of wellness, and how we know that there are systems, and depending whether it's at an individual or organizational or systemic level, there's a lot of policies and systems that don't contribute to wellness. We need to really recognize that there is a need to create equity. We have to address those systems that are anti-racism, anti-oppression, so that we can create a stronger wellness. It's at the core. And I think that's what the whole value set really does try to present a total picture of what we're trying to sort of demonstrate here today in the data. The recovery as we come out of pandemic being key. How do we relate to each other and the various organizations we're part of to come together in that renewal so that no one is left behind? That's a key part to the wellness and strengthening our wellness. Understanding, looking at the various perspectives in our community, the education around learning, the TRC calls to action, and just being aware that there are other perspectives, and depending where you sit in society, that matters. That matters that we share that, have that shared understanding and of our history as well, and connection. Some of us are, because of inequity in our community, they are excluded. There are groups that are excluded. How do we create a sense of that inclusion and true sense of partnership and belonging? And then you'll see sustainability that kind of surrounds it all. And again, Colleen can really highlight some of the key components to this. But that's not only sustainability of our land, but also of us as individuals, as a society. What do we need to do in order to provide a better future from all aspects? And that's what all I'll say about our values framework. It's a powerful tool for us to really utilize as common language and frame of reference, telling the story of our community in a way that points to action. A lot there, but I'm going to hand that now over to Colleen to expand a bit or to talk a bit about, I think what we did on the data side is really critical to what we're showing in the report and what we're going to highlight today. So I think I'm pretty much on time, maybe a few minutes late. Sorry about that. Colleen, if you want to go ahead.
Sure, thanks so much, Carm. You did a great job capturing the components of the value framework. I think it's really important to note that the purpose of the framework is really so that we can organize ourselves to come together and have a conversation that we actually have, regardless of our ideologies, of our political backgrounds, of the work that we do, that we all have a common agenda that is around the health and wellness of our communities, and that we can situate data in this framework regardless of all of those exterior indirect and direct complicated pieces of our work. And so we tried to take a look at the data. You can flip the slide if you want. We tried to take a look at the data that was existing to us, but as earlier on Carm mentioned, we're in a bit of a weird lull in data collection as far as the federal government goes, because COVID slowed down the movement of what we would normally be getting from StatsCan around census data. And so a lot of the census data that we were looking at was the same as the 2017 document. And what we didn't want to do was just repackage existing data and tell the same story. And so what we did was pull together a team who had existing relationships across jurisdictions, municipal government, provincial government, Indigenous government, and federal government, and looked at what new data we could use, what are the local contexts of the data that we can use, who's done some data reporting that we could access, what do agencies' annual reports indicate, what did we learn over the course of the pandemic response in the city, and how can we then package all that extra data above and beyond what we would normally see and say, like, this is the story we want to tell about that framework. The framework's also really large. It's the first time that we've implemented it. And so we really focused on just a couple of the core parts of the framework, knowing that there will be additional conversations. There'll be new data coming. StatsCan data should be arriving this summer. And so there'll be opportunities to do some updating. But what we did was take a look at the Saskatoon Interagency Response to COVID. We looked at Reconciliation Saskatoon's work and the framework that the Office of the Treaty Commissioner has put together. We did some preliminary data connections to the Saskatoon Poverty Reduction Partnership and the Safe Community Action Alliance. Both of those big collaborative spaces in the city work on health and well-being and are situated inside those value systems. The other situation, or the other reason that we picked a values framework like we did, was so that when we went to other agencies, they saw themselves in the framework as well. They saw the work, the poverty, I can talk about the Poverty Reduction Partnership because that's my other part-time coordinating job, is that we saw the work of the Poverty Reduction Partnership and the outcomes and the data that we're collecting as part of that framework. We speak that same language, we saw consistency in that language, and so it was really easy for us to say, okay, here are the pieces that fit into that framework that tell the story that you're trying to tell. SCA, the Safe Community Action Alliance, wow, are you going too fast? Is it doing it itself? SCAA and others, SHIP, the Housing Initiatives Partnership, they manage the PIT count. And so there's a whole bunch of community-based data that was really integral in telling a very specific Saskatoon story. And then we went back to the StatsCan data that we had access to and some updated federal government data and said, what of these pieces can we supplement this local data and this local context with to tell a more fulsome story that's slightly different than the 2017 document, but also recognizes the importance of the values framework that we're trying to explain.
Okay, so I'm going to circle back really briefly with a little bit more about what is vital signs. And so what I'm going to talk about for a second is why does our vital signs look the way it does? You know, data in itself, I guess, should be, you know, morally and socially neutral, right? But there's a reason why the phone book isn't the most interesting document, right? Too much detail without context. And it just, you know, the only page of the phone book I'm interested in is the one I'm on. So, you know, we have a challenge in presenting community data, and that's why Vital Signs looks the way it does. We use a few data points, really. I believe there are about 130 data points in this report, depending on how you look at how it's grouped and all that. They're presented as infographics. It's meant to be relatively readily accessible. You know, we've got a framework that has 6 main points to it, not 100. You know, and we sort of subdivide our ideas, even though they're all interconnected and interrelated. Likewise, it's about a story, and one of the lines that we often use here at the Community Foundation to describe what we do and what we're all doing in a community is, your story never ends. So Saskatoon's the story of 300,000 and some individual stories woven together, and we're all a part of that story. And likewise with vital signs, you know, we want to be able to say something beyond just counting things. And so we chose, as Carm mentioned earlier, 7 main areas. We resist the idea of numbering them because it's not as though one is the higher priority than the other. But there are 7 main things that we drew out of the data that the team put together that we think are important in terms of how we want to move forward in community. And Colleen and I will talk about those over the next few slides. Take it away, Colleen.
So collaboration is one of the things that was highlighted as a core theme. And so we thought we'd just take a couple of seconds and celebrate the successes and some of the chaos that came from the COVID-19 pandemic. If you flash back to our naivete of March 17th, 2020, we were all sort of sitting around in community around a table. And I think some of those original, I call them the original 6, are sitting in this meeting. And we were wondering if COVID was going to be a thing in Saskatoon or not. Flash forward a couple of days, they canceled the Junos, and we realized that perhaps maybe we should start thinking about what this means for the sector that we are all working in. And the sector that is generally already pre-COVID vulnerable to housing precarity, food insecurity, poverty, those types of sectors. And what was born from that was the Saskatoon Interagency Response to COVID-19 Vulnerable Sector Strategy. An incident command structure that was in place and still exists, not in its full urgency form of an ICS, but exists to provide supports for the executive directors of those agencies. But in that, the shout out, I guess, to the Community Foundation and the United Way was it needed to be resourced, it needed to be collaborative, it needed to be connected. And in that course of about 800 days or so, there was over $1 million in outside funding pushed to this. There were 35 or more core agencies supported, and there's more people coming onto that work as we sort of pivot back into the community and talk about the precarious housing and food security situations. But also that this agency stepped up when no other funding or support services were provided. The provincial government did not provide supports and services to the sector to provide supports to the folks who are the most vulnerable in our community. And our original intent in this was to keep COVID out of the shelter system. And so we wanted to figure out, how do we work collaboratively? How do we build capacity and use each other's resources? How do we get over things that we've seen in the past around turf, around resource sharing, around accountabilities, and all of those things when we came together, created a space where we actually, all of those fences came down, and as a holistic unit, we responded to the needs of that sector. Oh, I'm going right into the next one. So you're gonna get tired of hearing my voice. Also, my brain is a little bit foggy. I'm just coming out of the COVID fog myself, and so I'm like day 16, I think. 5 days negative now, though. The other thing that came up, and I should probably thank the advisory team for some really bold and brave conversations that we had, particularly when we're talking about equity, anti-racist practice, anti-oppressive practice. Those are really hard conversations to have. And so when we were talking about, how does wellness happen and how do we talk about long-term sustainability and recovery, we had to have a conversation about minimum wage and poverty. And so one of the things that the Poverty Reduction Partnership has done recently, and note these numbers are now old because the provincial government has made some changes, both to the income assistance program and to minimum wage. But more importantly than the actual numbers are the relationships in this graph. And the idea is that the line above the bar graphs is a livable wage. This is what you need to live comfortably, not affluently, but comfortably in Saskatoon. And so if you look at the bars below those, the blue bars are individuals and the yellow bars are like a family of 4 double earners. You see that minimum wage doesn't come close to the livable wage. You see that we looked at the CERB benefit as an idea of basic income at $2,000 a month. Doesn't come close to the livable wage. If you look at market basket measure, which you'll see in the next slide, but don't go there yet, that's the poverty line. It doesn't come anywhere close to the livable wage. And if you look at income assistance in this province, it doesn't come anywhere close to the livable wage. But also important in this slide is that the income assistance supplement doesn't come anywhere close to the poverty line, the second bar. And so what is going on around folks who are the lowest income earners? What are their wages per month? And how do we move people into a space if we believe that wellness, equity, understanding, sustainability, recovery is a critical piece? How do we start talking about income in a different way? You can flip it to the next. I think the next one's, yeah, market basket measure. So then this is the market basket measure concept. And so and there are a bunch of different poverty lines in Canada. So whether you're a LICO, low income cutoff, or a LIM, low income measure, or a market basket measure MBM supporter, doesn't, in the grand scheme of life, that doesn't matter. The federal government has made a decision that they're using market basket measure as Canada's official poverty line. So what does that mean in Saskatoon, and what are the basket of goods that they're claiming we need to use to say this is a livable income in this city? They have multiple different MBMs across the country. They take into consideration rural and remote, north, east, west, urban, small urban. There's a bunch of different calculations. This is ours specifically for Saskatoon. Also will probably be updated with the new StatsCan data. But you note it talks about shelter, which is housing. It talks about food. It talks about transportation. It talks about clothing. And then there's this little other box. But there are some fundamental pieces that are missing there. And that is specifically around young kids. There's no childcare allocation in this. So if you have children under the age of 5 and you know what it's like to seek childcare and how expensive it is in this province, it doesn't show up. It doesn't directly show up in the market basket measure. And so when we start talking about poverty, and particularly, you can flip to the next slide, particularly child poverty, we have to start thinking about the intersection between how do we recover from COVID? How do we have a relationship, a different relationship with income? How do we make sure that folks who need the income to come in from a variety of different sources are making a livable income? Because children are directly impacted by the families and the systems that they're living inside. Children don't work, they don't have income. And so when they're living well below the poverty line, their families are living below the poverty line. And so that is directly tied to what the income systems look like. And we know from the data across community partners and from StatsCan data that 29% or so children live in poverty in Saskatchewan in the province. And that we know that 54.8% of lone parents with kids under the 18 are living in the low income bracket. One step, or we hear in the news, like 2 paychecks away from requiring income assistance. And if you think back to that bar graph, income assistance is so far below the livable wage that if they lose their minimum income and fall back into the income assistance levels, then you're in a cycle, a perpetual cycle of not being able to afford the things in the market basket measure, not being able to afford your housing, not being able to afford food, not being able to afford transportation and all the other costs. And it's a vicious cycle for people to try to escape. And children become susceptible to it because their families are stuck in that cycle.
Okay, well, I don't know if I'll be able to speak to the level of detail that Colleen knows about society, but one of the things that we knew was true before pandemic is that there was already a rising need for mental health services in the community, and already a gap, just as there are in so many of these areas where we're trying to help vulnerable people. In 2020, we all became part of that vulnerability. And so this is a really interesting piece of newer StatsCan data. 53%, just below 53% of all Canadians, all Saskatoon residents, said their mental health was somewhat worse now or much worse now compared to what it was before pandemic. So we've all felt this. But if you look at slightly more locally gathered data on the right-hand infographic here from Saskatoon Tribal Council, they talk about the requests for mental health services increasing fourfold in some areas, anxiety going from 6 to 25%, and depression going from 6 to 17% during 2020. So this is, I think I just want to circle back briefly to the first of those 7 key learnings that was featured in the slide Colleen described about the interagency response. We showed through interagency that it is possible in a crisis for the community to come together, funders, the city, all these different organizations, and make something happen really quickly and get a job done. during a crisis? Well, if you're a person who's living on the street, especially, I mean, we're just barely out of this brutal winter that we've just come through. If you're a person who's living on the street, if you're a person who's living in poverty, and if you're a person who's living with acute mental health needs, that crisis is still happening for you. In fact, it supersedes anything that was going on with COVID, your individual situation. And some of those situations are made so much worse by COVID. You know, the likelihood of being asked into somebody else's household during the height of pandemic and so on. So I think this is something we really need to pay attention to. One of the other things that really jumped out at us as we look at homelessness in the community, it's a finite number of people. 500 was the 2018 count. The last point in time count was actually April 28th, just a couple of weeks ago, and we're interested to see what the new data is going to be. But even so, it's 500 people who self-identify as homeless, and the really interesting piece of this is that 85% of those people are Indigenous. And I can't help but think that that reflects, you know, some of the consequences of the residential school system and what's happened inside Indigenous communities during the last few generations. The other really sad point is that 65% of those 500 people who are homeless were exposed to the foster care system. So we don't say they were in foster families because very often people are in and out of foster care or with one family to another. A lot of where homelessness starts for some people has to do with the fact that once you turn 16, you can opt out of foster care and become independent. And many young people just leave and hit the streets at that point and begin a cycle that's very difficult for them to get out of. So we can't help but notice that this is a problem for all of us to be involved in, but it disproportionately affects Indigenous people.
Don, can I add one quick thing?
Please do.
Can you just go back to the homelessness slide, please? If you think back to what I was talking about, so we often talk about the disproportionate impacts of particularly Indigenous folks in certain systems like homelessness, but we don't talk about the underrepresentation of them in other systems. And so if we think about income and the systems that we're talking about, which is like economy, there is a historical legacy of the disproportionate exclusion of Indigenous people from the economy. When you look at minimum wage precarious employment, it's generally speaking women and women of color and Indigenous women who are in those precarious, low-paying minimum wage jobs. And so there is a direct relationship between child apprehension, family breakdown, income, and public policy that doesn't support family at a livable wage.
All right, so this particular set of statistics appears in the report next to information on housing starts. And if you look at that infographic, you would see that housing starts have been relatively strong, but that doesn't necessarily have a really direct or immediate impact on the availability of affordable housing. So we found that the demand really far exceeds the supply of affordable housing. And if you look at the third line in this graphic, you'll see that for the most common types of housing requested, 1 and 2 bedroom units, the average wait time is over 2 years. And then for 3 bedroom units, the wait time is still well over a year. So, you know, that's a really problematic situation. Probably to deal with chronic homelessness here in our community, we need 2 key elements. Yes, we need units of affordable and transitional housing in order that people can be housed. But because of the situation that these people find themselves in, they will also need other supports to succeed in remaining housed. And, you know, it's not just income support, it's psychosocial supports, it's supportive networks, all the things that many of us enjoy just as part of having grown up in community and having friends, family, and other people who can look out for us. Some of the people that we're trying to help become permanently housed don't have those networks. So it's a really problematic thing, and we need to do what we can to increase affordable housing in the community. Next
So
slide.
Dawn, I want to just mention at this point, so recently, like this week, in fact, a new network was announced to hopefully deal with the housing situation. And again, it's not new in our community. A lot of this data and sort of points of information you may have already seen, you're aware of. We're amplifying it by putting it into the 7 learnings. But this network, which I know Sylvia, who was part of the Saskatchewan Home Builders Association, the Realtors Association, Habitat for Humanity, the Landlord Association. So these are all other professional bodies that are coming together to try to I would hope, deal with some of the supply side, as well as now partner with the program delivery and support side, as Dawn was mentioning, 2 components of it. So really, really good, innovative way of stepping up to deal with some of this, which has become chronic. Just wanted to add that. So let me advance.
Sure. So last on our list of 7, but realize, that the list of 7 these are a few things that stood out. There are certainly lots of conversations that can be generated by the data, lots of different ways of looking at things. But because we're the community foundation, we can't help but have at least one eye focused on the charitable sector. And, it's well worth noting, and many of the people who are on this call, I know, will already know this, but the charitable sector accounts for 9% of the gross domestic product in this country. We're bigger than gas and oil. And when the charitable sector is in trouble, people in Canadian communities and people in Saskatoon will face challenges. So this is a very simple infographic, right? It should be very easily apprehended by everybody. 3 of the key ways that charities sustain themselves, 3 sources of revenue: event fundraising, donations, and earned income from productive enterprises, all down during the pandemic. The only form of revenue that went up was government funding in the form of mostly emergency programs like the Emergency Community Support Fund, Canada Healthy Communities Initiative, and there will be more coming. So that's, I guess, some good news. But what will happen as that all settles out and we go forward from this moment in time? How will these charities recover their revenue? I think particularly of charities in our arts community, many, if not most of whom, depend on ticket revenues in order to sustain themselves. Well, when we haven't been able to have, events, and even now when restrictions have been removed, there may be a reluctance to attend events among people who are concerned what's going to happen. How will we recover? Some charities, even in Saskatoon, have ceased operations, and we're going to see more of that as time goes on if we don't find ways to support them. Also, I just want to quickly reference the last 2, and then I will wrap, Carm, if you want to just go back for a second. So 1 in 3 charities saw layoffs or reductions in staff hours. 3 in 5 saw reductions in volunteer hours. And that was particularly a challenge in the interagency work where, so many of the grassroots charities like Friendship Inn and the food bank depend on volunteers to deliver. And especially during those first months of the pandemic in spring, summer of 2020, volunteers weren't sure, is it safe for me to be here? Can I still help out in the way that I wanted to? So, we've got to reinvigorate. That's part of our recovery as well, is reinvigorating that spirit and finding safe ways to help each other. So we're going to create some breakout rooms, and I'm just going to automatically assign half of the crowd into one and half the crowd into the other. And we'd really like to hear from you. I'm going to pause the recording that we're doing of this session, but we'd like to hear from you. Which of these 7 learnings resonates most strongly with you and why? So we're going to use a new tool in Zoom that's whiteboards, and we'll show you what to do. So I'm just going to create the breakout rooms, and then I'll pause the recording. So everybody will be put in one or the other, and Carm will take breakout room 1 and I will take breakout room 2. We'll see you shortly. I'll just pause. Yeah. And I've now resumed our recording.
Okay. Thank you. Thank you everyone for taking part in that rapid fire whiteboard that didn't really work as a whiteboard for us, but Colleen captured what we needed to capture. You know, and I think I'll say one thing, and that is there are many things in our community that need attention. And I think, and that's a big part of it, right? How do we use the resources we have from the various sectors to give attention to some things that are important? We, you know, although we're talking about things that they have been chronic crises, they are not acute like the pandemic. And that whole drive to mobilize and respond and come together, regardless of mandates and jurisdictions, happened in the sector during the pandemic. And these other issues that we put in as our 7 learnings, again, you may see things differently in what the data and the report provides you, and that's a good thing. But I think what I'll say, and I don't know if it was any different in your group, Dawn, is that many things are important for individuals depending on their circumstance, and they are all important. And so let's acknowledge that and see what we can do in a way moving forward.
Okay. I'll sum up the discussion in my group once I finally got the yes very quickly. Obviously, there's a lot of complexity here, but there was a significant portion of our discussion that was about the complexity of housing and homelessness from many different points of view. You know, with newcomers and developers, all points of view, and a number of comments about the need for collaboration, both in resourcing charities and just in a broader sense in the community, to involve the private sector to reduce duplication and inefficiency and ultimately get things done for change. So I'll stop there.
Thank you. Thanks very much to everyone for participating in our rapid fire breakout. And this really says it all, right? Together we can do much more. And there's so many different ways to get involved, and many of you have, and we thank you for that. But tell others, talk to others, ask for a presentation in a groups that you represent. Figure out how to make space for others so that there is that connection and that understanding. And there's other ways to volunteer and just engage either through us or through your own organization. Pledge your own TRC call to action. And as Dawn referenced earlier, the story of Saskatoon is a story that will never end, and we have a moment in time to really write that story and how we want it to be in the future for children and our grandchildren. I think that is it. Joanna is going to send the survey to each of you, and I believe it's in the chat. You can click on it, it will open a browser and you can submit your results. And we just want to hear more from you in the future. So thank you so much for attending and your time today. We had to digest this in pretty much an hour. I see a few new folks have joined us. Wanda on our board. We've got Heather McDonald, fund member, so fund holder. So there's a few other names. Thank you so much for joining in, and we will talk again. Now, how do I stop sharing? There we go. All right, thank you. It's tough to get a real sense if this presentation worked for our group here. So any feedback is good, is positive for us. So please do let us know in that survey. That will help us a great deal. Thanks all. I'm going to sign off somehow.
Thanks, everybody.
Thank you. Nice to see you, Rena. There's a few nice faces I haven't seen in a while. This is great. Thank you.
Are we sticking around or am I
Oh,
leaving?
we can. Yeah. Yeah.
You can probably stop recording.